And so I think it's important that you understand the clinical trial process. I'm not saying that the pill is bad. I just want you to think about how to make health decisions for yourself. You want to be especially vigilant, especially staying on top of it. Once I got the information I needed, I started to move in that direction about how to make health decisions for yourself.
In your mind, what would you say to brothers that's not vaccinated or just people in general?
I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do. But that was nice. I was very humbled and proud to co-host an award-winning podcast. So thank you, CMPRadio.net.
Thank you very much, guys.
So welcome back.
Hey.
How was your summer?
It was great.
What'd you do?
I actually took a cruise.
You did.
Yeah,
it felt like
cruise.
You was gone for like 3 weeks.
Yeah. We went to the Bahamas.
Nice.
Wonderful, beautiful blue water, and just, oh man, I'm reminiscing right now.
I know you like flamingos.
A lot of eating. I love flamingos.
Did you see
And
any
I went
flamingos?
to a flamingo island, like a small little island, but it was like at a zoo. It was only really flamingos and raccoons.
How'd you feel?
Yeah, they had raccoons at the zoo. Yes.
Oh,
They did.
That's
But I don't know why. But they had raccoons in the cage. I'm like, wow, we see them for free. So,
wow.
but I
Yeah,
did.
that's
I stood with the flamingos. I stood up with them. We talked. They danced. Yeah, I'm a big flamingo fan.
That's good. Well, I'm glad you found Holy Land.
Yes. I was in my glory.
That's good.
Yeah.
Now, let me check on your health. Last season,
Doc.
you was started on some blood pressure medicine. Well, shout out to you because you went to the doctor.
I did go.
Shout out to Chest Pen for accepting him as a new patient.
Thank you. I forgot my doctor's name, but go ahead.
That's because it's been too long. Because I was going to ask you. You started your medicine. Have you been taking it? Have you been back for a follow up, or how's that going?
Doc. I'm gonna be honest. No. But I'm getting ready to kick it back in.
What happened?
I just felt good after I started taking the blood, medication, and I stopped.
Are you stopped taking the medicine?
Yes.
Why?
I don't know, Doc. I didn't re-up, and I don't know, Doc.
Yo,
you put me on
you
the
on
spot.
live TV telling me you stopped taking some
I'm
medicine.
supposed to be the street practitioner.
Are you serious?
Yes, Doc. I'm gonna get back on, no, Doc. I'm good. Actually, I've been still checking my blood
No,
pressure.
you ain't.
Good.
Don't be making stuff up.
I'ma
Don't
get
be
the
making
nurse
stuff
to
up.
check
You
my
ain't
blood
check no
pressure at
blood pressure.
school.
You're not taking your medicine.
All right.
Come on, G.
I know.
You got to do better.
I do, and I mean, I want to preach what I'm teaching. So
When you gonna start taking your medicine again?
I just gotta let's set up another appointment.
You don't have no refills?
No.
Cause he ain't. Yeah, because he tracking you. He probably didn't give you refills just to see if you was going to call to come get more.
I think so, because that's how it was like brought to me,
And
like
he
when I
wants to see
first
you.
got when I picked them up. Shout out to Chest Pen. I'll be back.
When you gonna schedule your appointment?
It's probably tomorrow, Doc.
Tomorrow?
Like I mean it. And I'm gonna send you a picture of my appointment, and we'll be able to talk about this next week and get out this gray area.
Lord, help us all.
Seriously.
All right, G. So you're gonna schedule your appointment, get your refills, get back on your meds, because
Yes.
you know when you don't take your blood pressure medicine, your blood pressure just shoots up, and
Right.
it is attacking your blood vessels. And that means that you can have eye problems, kidney problems, heart problems, like all these issues that can be prevented if you just took your medicine. I mean, was it causing you any problems? Did you have like any side effects?
Not really.
Could you afford to pay for them? Like,
Yeah,
were they
actually, it was
expensive?
cheap.
Because I'm just trying to
I
figure
really
out.
don't have an excuse, Doc, and you're making me sweat. I'm sorry.
All right.
We just got it's a black men thing, and we gotta work. We gotta get out of that.
Yeah, we're gonna work on it.
We gotta get out.
We're gonna
that.
work on it. Well,
I'm
you had a
sorry
busy.
to my
Well, you know
viewers.
what? I have a confession myself.
Okay.
In season 1, I had said that I had got my first cavity diagnosed, and I scheduled a dentist appointment, and I canceled it because I was scared to get a needle in my mouth.
I remember that.
And I rescheduled it, and then I canceled it again. But I canceled it because I just had a conflict. So then I rescheduled it, and it's coming up in like 3 weeks. I'm gonna do it this time.
Okay.
So I mean, we all got work to do. We all got work to do.
Okay.
I don't place judgment on anybody. I just try to understand.
No, that's
You know what
good
I
though.
mean?
But
I'm
I
just
need
trying to
that though.
understand.
I need that, and I mean, I'm out here telling brothers what to do and how to do it. So I have to lead by example.
Absolutely. So
Right.
I'm gonna get my cavity filled, and you're gonna get your blood pressure
Yes.
under control, and we
Yes.
gonna keep it moving.
Right.
All right. That's fair enough. Now you had a busy weekend. You went out. Oh, and you got a promotion. So you are officially Health Educators Community Outreach Coordinator. Congratulations.
Thank you,
Good job.
thank you. With
on
a
all
clap at Les. We don't get no claps. Can I get some claps, please? Okay.
Here come the clap.
Thank you.
Congratulations. So, you were out at the Chester Senior Center.
Oh yeah,
this
shout out to my
weekend.
folks over there.
And you was doing your thing. I think we got a picture of you out there with the ladies.
Yes.
And you look real comfortable.
Yeah, I had a
was
great
like-
time. They actually want me to come back. I told you that.
I was wondering if they was
Yeah,
going.
they really enjoyed me.
I guess they do want
Yeah.
you to come back,
Yeah.
Georgie.
I was playing bingo and everything.
You got right in the groove.
You
You got right. I know they can't wait for you to come back through them doors.
She told me she wanted me to taste her greens and everything.
Stop.
Some lady.
You need to stop.
I'm like,
Stop
what?
it.
You're green.
Stop it. I'm not even going to touch that.
No, listen. She
I'm
said
not touching
that.
it.
I'm like, okay.
I'm sure you got offered a whole bunch of stuff, so
Yeah.
you're gonna be over at the senior center.
Yeah, I'm
now.
gonna come. I'm gonna check them out. I mean it. We're gonna do an event there, and I'm looking forward to meeting some new people and everybody that I met. Miss Vicky and the crew. How y'all doing?
Jamie,
Yes.
good peeps over
Yes,
there. So
yes.
thanks for going over there, holding it down, and
Oh,
thanks
yeah.
for holding down all the events as the community outreach
Yeah, that's my
coordinator.
title.
Do your thing. Do your thing.
Yes.
So real quick, I did want to mention our condolences go out to the family of Irish Greenstead. She was a former member of the group 702.
Oh,
Where
yeah.
my girls at?
Oh, yeah,
Find
yeah.
them
I remember that.
Give
That was
them
my
that.
joint, too.
Yeah. So she was only 43,
Yeah.
and she had a long health battle. I don't know what it was, but they said that she'd been battling for a long time, and she has her her wings now.
Wow.
And I was really shocked to hear that, especially her age. I'm 42, so it just really hit home with me, and it's just a good reminder that life is short.
Yeah.
Life is short. And she had a twin sister that passed away like 5 years ago of kidney disease. So I was wondering if she also had kidney disease, because that is hereditary. And I want to remind people to know your family history, and to tell parents to tell your children your health history, because that helps them to know what they may be at risk of.
Right.
So having those communications and not hiding stuff, talking, keeping it real, letting children and grandparents know what is going on, so that we know what to look out for, because kidney disease is one that is truly hereditary.
Really?
Like my uncle, his mom had kidney disease, his mom had to get a transplant, and all of his siblings had to get kidney transplants.
Wow.
They all ended up with that same kidney disease. This is my aunt's husband. But
Wow.
yeah, so we got to know our family history. Absolutely. We absolutely do. So that was that. What else is happening out here? Oh, there's a new COVID vaccine
About
update.
time.
Y'all know we're going to talk about that. So the CDC is recommending that everyone 6 months and older get the updated COVID vaccine. It just became available earlier this week. So make sure you're checking with your pharmacies. It's also a good time to get the flu shot. You can get them at the same time. If y'all remember last year, I got mine at the same time at homecoming on the same day, and I'm still alive. I got a cavity, but I'm still alive. So y'all can get y'all flu shot and COVID shot at the same time. Let's stay up to date with these changing variants, so we can stay ahead of the game.
Yeah, I'm ready.
Are you gonna get yours?
I think so.
I was gonna ask you.
I think I'm gonna do what we normally do. Wait for the numbers.
Yeah.
I like your idea with that. Let's
little
wait for the
waiting game.
numbers.
Listen,
Yeah,
I'm not getting
waiting
mine
game.
this week. I'm gonna tell y'all. I'm gonna keep it real. No, I don't be first in line for stuff. I'm not getting it this week.
Right.
But I'm definitely gonna get my COVID vaccine and make sure I'm up to date. I got to get the kids vaccinated because they didn't even get the last booster because I was like, okay, I don't know if they really need it, but they are gonna get this updated one. I'm gonna get mine, Bilal gonna get his, and we're gonna stay healthy.
Right.
I'm not gonna be a statistic.
No.
I'm not gonna be a statistic, COVID. You're not gonna make me a statistic, so I'm gonna get my vaccine.
But somebody made a real point this week when I was like out in the streets, and they said like it's an upbeat, like in COVID cases, and it's probably because the vaccinations is wearing off.
That's a good point. So there is an uptick in COVID cases, and that is for a number of reasons. So usually in the summer, people are more outside, they're out and about, they're living their best lives, and COVID transmits easier in enclosed spaces, where there's no air circulation, air movement. So people move back indoors as the weather starts to get cooler. So you usually see a bunch of viruses start to go into circulation around this time of year. The flu is one of them, RSV is another one. So just, common colds start popping up around this time.
Right.
So that's partly true. And then another part of it is that our protection from the vaccine does not last forever.
Right.
You start off with high protection, and then over time it just goes down, and that's why you need to get another shot. Another thing is that the strains of the COVID virus changes over time. Mm-hmm. So it's always mutating, it's always trying to stay ahead of us, so that the protection we have can't hold it down. Mm-hmm. It's just trying to survive, and so because of that, it changes, so they have to create updated vaccines that protect against the changes that the virus makes.
Okay.
So it's a bunch of different factors, but yeah, so the protection does go down.
I learned that at the senior center. Somebody told me that at the senior center.
Oh, okay.
Yeah.
I'm sure you was listening to the ladies at the senior center. They can get some greens. You're going to be eating up them greens.
Yeah. Thanksgiving coming up.
All right. So I just wanted to mention that. Let me see. So today we have a special guest, a very, very, very special guest, Dr. Kai Turner. She is a pediatrician with Chest Pen Health Services, which is a community health center right here in Chester, Pennsylvania. But there she provides care to children and to adolescents. Her career aspirations as a pediatrician are centered in providing medical care in urban communities, and she has a personal interest in international medicine, providing health care to medically underserved pediatric patients. Dr. Turner is in the house. Thank you for coming.
Thanks for having me.
What's going on, Doc?
Yeah, you're welcome. So, welcome to the award-winning Keeping It 100 podcast.
So
I'm not
proud.
sure if you
So
had
proud
caught
of you
that. Thank you. But we just wanted to have you back on, because you are no stranger to the show. You were on last fall. I think it was around this time.
Yes.
That we came out to Chest Pen and did a live show. So welcome back.
Thank you.
You're welcome. We welcome. So we just wanted just to start off by talking about vaccines, not COVID specifically right now, but G came up with a good question about the vaccines in general.
It's on me.
George, if you don't ask that question.
All right. But I wanted to talk about the chicken pox and all that. So that's the first one.
George.
Okay. So basically, I came up with the theory, like old school, how chicken pox, the kids don't get chicken pox anymore. So we rarely hear about like polio and certain other, immunizations, and just going forward, like, what do you think changed? Like, what basically changed from those times, from like basically, I guess, the 70s, 80s, and 90s until now?
Definitely having vaccinations against a lot of the infectious bacteria and viruses. I remember back in the day, 1990s, right, when we used to have chickenpox parties. You get the chickenpox, it's super contagious. Your parents kind of get you guys together so that everyone can get it over with. Now we've been fortunate enough to have a pretty efficient vaccine that children don't have to suffer through the actual illness in order to have some immunity. We usually think about chickenpox outbreaks with just skin rashes or lesions, but serious chickenpox or varicella infections can actually cause death, swelling of the brain, pneumonias, and I think that we've lost touch a little bit because we don't see it often. We think that it is not possible for kids to have it. Some families choose to not vaccinate their children, or some children live in different countries where there might not be a vaccine, or it might not be a regularly vaccinated virus or bacteria, and we have to keep that in mind. I know we've probably heard of herd immunity. So if the majority of the population or the majority of the people that we're around have immunity because they're vaccinated or because they've had the actual illness, it does protect us. But it's not 100%. There was recently an outbreak of, or suspected outbreak of chickenpox in a child who had been vaccinated. So it just depends, and I don't know if that was actually confirmed or not, but we forget about some of the infections because we're fortunate enough to not experience them. Polio is one of, I'm glad we don't have to see kids go through that, and that was one of the older vaccines, not necessarily in the 90s, but that is an infection that actually attacks the spinal cord, and children were paralyzed, they couldn't walk. You have to think about your spinal cord is really important for all motor and all type of movement. So that's one that we luckily do have an effective vaccine against.
Wow. So it sounds like having those vaccines has made a big difference. Because we all had chickenpox. And I was wondering, why did I have chickenpox, Mom? But then when I looked it up, they didn't have a vaccine when I was at 8. Yeah, right? So I let her off the hook for that when it just wasn't available when I was that age. So it's good that we're not talking about those diseases anymore because we have protection and we have good vaccines that work. And hopefully we get people on board with, when there is a new thing, you just have to do new things to protect it. And I understand the hesitancy because, as y'all know, I didn't want to get the COVID shot either. It took me a while to get vaccinated, but we have to start getting out of our feelings and looking at facts and information and making decisions based on that. So I'm glad that we don't talk about chickenpox no more, or polio, or a lot of those diseases. That was a good question, Jay. Thank you. Now, I just want to confirm, kids can get COVID and the flu shot at the same time?
Yes. So we start vaccinations against influenza as well as COVID now at 6 months. We understand that it's a little bit scary. Like at 6 months, children are usually getting 2 other vaccines that they've already received at the 2-month and 4-month mark. So initially before COVID, flu was the new shot. Like, let's introduce your body to a new shot, and if your body reacts with the little sniffles or something different than when you got your shots at 2 or 4 months, then we know maybe your body is just reacting to that. Because now we have the COVID vaccine that we're also introducing at the same time, some families might be a little bit hesitant to do both of them in addition to the other shots that we're routinely giving, and I can't totally understand that. So even though it's actually recommended to go ahead and get both the COVID vaccine and the flu shot at the same time, if parents want to say, okay, give me a week, come back for the COVID shot, then that's fine too. And the other thing is, during the first season of the flu shot, especially at 6 months, if we're just starting the flu shot, the recommendation is to give like a booster flu shot 1 month after. So what I typically do with families of infants, do the first flu shot now. When you come back for your second flu shot, which would be a month after, as long as they've tolerated the flu shot and the other shots that you got at 6 months, let's do the first COVID shot.
Yeah,
then come back and do the second COVID shot.
That makes sense. Does Chest Pen have pediatric COVID dose, like the new?
We had all of the ones before they just announced the new one.
Mm-hmm.
So we're actually in the process of receiving those.
Okay, I was wondering because I haven't been able to find them at any pharmacies. I've been trying to direct people to places to go, but I cannot find anybody with the 12 and under. Well, 11 and under.
I think we should have it in the next couple of weeks, but we definitely had to discard a lot of the ones that we had because they're like, oh, this is the new one. Get rid of the old. So we're just waiting for us to actually get them.
Okay. Quick question: if a child has COVID, if they do get COVID, do they still have to stay home from school, or like what's going on with that?
I honestly look up the CDC guidelines like every day. So the last guidelines that I saw was if the patient or the person is asymptomatic and has not had a fever within 24 hours, they can return within 5 days.
5 days.
I still would recommend, like, of course, washing your hands, wearing a mask. But if the person is symptomatic, so fever, runny nose, cough, it is recommended to stay in isolation for 10 days, which is the normal course of most viral illnesses, as far as not actively shedding the virus so that it's not as contagious.
Okay. All right. Okay. That's fine enough. Thanks for that. Do you got a question?
Oh yeah, let me go. I got some good stuff here. So when kids were younger, they typically get their vaccination and their wellness visits. But as they get older, they don't need as many vaccinations. So I just was thinking, like, to tell the viewers, like, what are wellness visits? Why are they important for older kids?
That's a really,
and what
really
are you looking for,
good question. Right. Because I think we historically have seen a big drop in attendance for wellness visits once that first childhood series of vaccines is completed. And the purpose of the doctor or a well child visit is not just shots. And especially when we want to build a good rapport with the children, the last thing we want is for them to only associate us with some pain. So during the first year of life, typically we see babies at the newborn period, a 2-week follow-up just to make sure weight is good, 1 month, 2 months, 4 months, 6 months. And then there's a break, 9 months, 12 months. After that, there's only like a couple series. There's a 15-month series shots. We give shots at 18 months. And then they're kind of free until it's preschool or kindergarten time. The issue is that 18-month, 2-year mark are essential for development. So unfortunately, more common than not, if families haven't been there for the 18-month visit, the 2-year-old visit, there's a lot of things that possibly were missed. We typically check hemoglobin and lead to make sure the kid doesn't have anemia. There's no lead exposure, especially in the Chester area where some of the houses were built older in the 70s. We check for autism so that at least we can get on top of services, get the child enrolled before the time cutoff of 3 years when some services are not available anymore. We check to see interaction between the parent, between the child, stranger danger, whether they're eating okay, whether they're growing okay. And we try to make sure that children are meeting their milestones so that we're not waiting until it's time to go to kindergarten and they don't know their letters. They don't know colors. So those are some of the things that we try to pick up and provide services for if services are needed. And if we're not seeing the child, we're not able to do that. In addition to that, we are trained to make sure the child is well, make sure there's no abuse, make sure there's no other issues that have not been discussed. So it's really important to keep those well child visits and not drop off after, you know, the vaccine series are done. For the teenagers, like the older kids, it might be even more important that we're seeing them more often. And I say that because there are a lot of things out there in terms of, I say sex, drugs, rock and roll. Like we do an assessment for mental health. We talk about depression, we talk about anxiety, and especially now since COVID happened, there's a lot of social anxiety. There's a lot of other things that kids might not feel comfortable talking about, or they don't realize like it could be a problem. The other thing is that we do sexually transmitted disease testing starting at the age of 13 in the state of Pennsylvania. A lot of the more common infections are asymptomatic, meaning kids might not know they have it. So if they're sexually active, we still want to check your urine. We want to be able to inform you of being safe, even if it's something that, you know, we need to have a bigger conversation about if you're involved in it, but at least keep you safe and treat you so that you're not dealing with a long-term infection that you didn't even know you had.
That was a lot. So there's a lot of reasons to make sure your children are still seeing the doctor well into their teens. Now, how often? I mean, I guess at least once a year they should be coming in for a check-in to do the mental health screening, it sounds like, checking for STDs, especially if they are sexually active, which you may or may not know, so they might as well just go ahead and send them into the doctor. You step out the room and let them have a conversation with the doctor, because I know that the truth comes out when mom's not in the room. It was definitely like that for me, so let me just put myself out there. The truth came out when my mom was out the room. I could talk to the doctor in a way that I just didn't feel comfortable talking to my mom. So definitely taking them in for those checks are important, especially like you said, mental health right now, and these young people, it is a serious thing, especially coming out of COVID. They have dealt with so much through COVID, coming out of that, trying to reacclimate to society, and all the stress that they went throughout COVID has, you know, it was a lot. And it was a lot for adults to cope with. And, you know, kids don't always have the coping skills or the tools to pull out to deal with those things. So coming in and getting the doctor's visit and having you all do a check-in and a checkup is important. So if you have not had your child in the doctor's office in the last year, please schedule an appointment and make sure that they get seen by a pediatrician. And this is throughout the teenage years. I'm not talking about little kids. I'm talking about young adults, 11, 12, 13, and up. They need to see their doctor at least once a year. Is Chest Pen accepting new patients?
We are.
Nice.
We are.
Okay, good.
So like the general rule is starting at 3 once a year.
Okay.
Unless we need to see you more often for developmental stuff or sick visits. And the other thing that kind of popped up was, I don't know if it's because of COVID or just in general, but we're seeing a lot more obesity, as well as pre-diabetes and newly diagnosed diabetes that we're diagnosing in the office.
Wow.
So some of those things that you might not really think about, we're thinking about them. So we're doing blood work, we're checking urine, we're making sure that everything else is good. And it's also good to have continuity with your provider. So if you're missing years of your physicals, you don't have that rapport with your provider that if something is wrong, you might not feel comfortable talking to them either. But if it's at least an annual thing, and you're seeing this person, you trust this person, it makes it a easier transition. You know, even into adulthood and going to adult care, it makes it a lot easier if they're used to doing these things. Yeah,
that's true. I also want to talk about sleep. I was reading about teens not getting enough sleep because they're on their devices at all hours of the night, and they are sleep deprived, which means in the morning in school they're not 100 because they didn't get enough sleep the night before, and this is going on for weeks and months and years. And so how much sleep should young people be getting?
So it actually, based on the American Academy of Pediatrics, the recommendation varies from 4 months to adulthood, but I think the general consensus is at least 10 hours, which is crazy to me, and I'm a hypocrite because I don't do it.
Oh, I should get 10 hours?
All of us. We need, I know we usually think 8, but definitely children should be getting 10. And little babies, they run the show. So whenever they want to sleep, they sleep.
So they gonna get their sleep in.
But for sure, The screen time is not good.
Yeah.
Even in the office, we do vision checks, and you can't see anything past the big E, but you're on your cell phone during your visit. So it's a rule of mine: no phones. When we're talking, good. You need to pay attention. This is your visit. It's not for your parent necessarily. It's more so for you and your health. But I do feel like social media, Roblox, all the things, and it gets to the point where it's not just about your vision. It's about social interaction. It's about, you can play on the phone, but you can't speak yet. And people look over that if they think, oh, they're savvy enough to do something on the tablet. That's not enough for development of the brain. Yeah. And I feel like it really stunts development, and it stunts children's ability to cope, to interact, to bond with peers, to bond with their family, because they're so attached to a device. And adults are guilty of it too, but for the most part, our brains are pretty developed and not changing much. Yeah. And luckily, we didn't have all this when we were their age, so we should be pretty good. But with kids, it's pretty disheartening, like just to see them glued to the phone, and the tablet.
That's tough. I know we got to wrap up, and I wanted to. So Chest Pen historically has been in Chester. Shout out to Chest Pen celebrating 50 years. Wow. 50 years this year. Congratulations, Chest Pen. And historically, we knew it as a free clinic.
Yes.
And I know that stigma comes with, oh, that's the free clinic, I don't want to go there. P talked about his, I ain't going there. Right. Yeah. So I just wanted to know, what do you want the people to know about Chest Pen?
That's a really good question. So Chest Pen is a federally qualified health center. I don't call it the clinic. I don't call it the free clinic. I call it the doctor's office. But in the community, you might refer to it as a free clinic. I think for me, when I think about free clinic, the stigma is it equates to less quality of care. Right. And I know that every place has their issues, whether it's a private doctor's office, a hospital, an FQHC, or or a free clinic. But what I can say from my personal experience of being at Chest Pen East Side, which is in Chester, is that if the providers, including myself, did not have a passion to serve, we would not be there. Right. So for me, I believe we give amazing care. Some things could be changed, with, I think that there's pressure on everyone when there's more patients that we're like, we want to help everyone. That means you're going to wait a little bit. It might take a little while to get in the door. But I can personally say that it's a passion for the providers that are there to help the community. And I don't think, I know that the quality of care does not diminish just because of a patient's ability or inability to pay for service.
Now, Dr. Kai just told y'all, Dr. Kai Taylor told y'all to come over to Chest Pen. You might have to wait a minute in the waiting room because
and we sorry.
That's how it is. But I gotta wait too. Like when I go to the doctor's office, it's just like any other office. Like just sit and be patient, and as soon as they can get to you, they can. Because what happens is, for the doctors that care, they take their time and they're not going to rush, and they're going to make sure your questions get answered and you're good. And so that means that the person that's coming in next may have to wait a little bit. And so I actually want a place where I gotta wait, because I know when it's my turn, I'm gonna get the time that I need to get all my questions answered and all my health concerns addressed. So there may be a wait list to get in there, but they are going to take care of you. So how can they schedule an appointment if they want to come to Chest Pen?
And don't miss your appointment. That makes it worse. Vaccine catch-ups.
Look at
developmental
milestones, melt under the table.
Labs. We're trying to catch up on 3 years. Don't do that to us. And then in addition, I will just say that because we love our families and we typically take care of multiple people in one family, parents are like, hey, his brother didn't go to school today. Can you do this refill? You guys have to be considerate of the fact that other people are waiting, and we try our best, because especially pediatrics, we're suckers. We're going to do whatever you need, whether it's call you after hours, we're going to try to do it. But remember those instances when you have to wait a little bit. Like if your child was going through something, you would want us to take time to deal with it, and don't assume that we're not busting our butts to get into the next room, but I'm not gonna cut someone off who might really need help just to rush to the next room.
All right.
Thank you, Dr. Turner. Thank you.
To make appointments.
To make appointments.
This has been a point of contention, but there's a couple ways. I have found that the most successful way is to call the clinic or
the doctor's office.
Call the doctor's office. There is a nurse line. We are working on checking that regularly. So give us a day, don't call back 2 minutes later. And usually what they're doing is when you say you need an appointment, please tell us your name.
Right.
Don't say, hey, this is such and such. We need your kid's name. We need the birthday. So at least it helps us call you back. Leave a phone number. Right. So at least we can give you a call back to get you scheduled. I think that's probably the most productive way. But the front desk is sometimes available to get you scheduled as well. And then there is a call center. I would urge you guys, if you're calling for a physical, please say physical. Don't say I'm following up for a physical, because then that means you're going to be put in a follow-up slot, and it puts all of us in a bind where we want to make sure we take care of everything you possibly need. But there are limitations when you're not scheduled correctly. So I think we can do a better job of that, and then parents as well, of knowing why their child is coming.
Do you know the phone number?
610-872-6131.
Can you give it to them one more time?
610-872-6131. 81. Oops.
Give it to him one more time, Dr. Turner. I think Dr. Thomas.
I'm gonna make sure.
I see Dr. Thomas holding down the chat for us. Thanks for everyone that's watching and checking us out today, leaving your comments. We appreciate it. But yeah, so this was really, really helpful. I hope this encouraged a parent or someone to tell a parent to make sure they get their children to the doctors at least once a year to make sure they're good.
610-872-6131.
Gotcha.
Bam. Schedule your appointment at Chest Pen, 50 years. That's right there on 9th Street by Avenue of the State. So make sure y'all do that. Now remember, y'all, COVID is out there. We do have a new vaccine that's available. So make sure you go to any pharmacy so you can get that taken care of. We are going to be in at Local 413 next Wednesday. We're doing a COVID vaccine clinic from 6 to 8 there. Right now we only have the adult doses available, 12 and up. So next Wednesday from 6 to 8 we will be at Local 413. So make sure y'all come out there. If you want a COVID, the new COVID shot, there with a flyer. But y'all just be safe in the meantime. Mask up in crowded places. Wash your hands. Use sanitizer. And keep it real.
Yeah, see you on the streets.
We gonna see you. George gonna see y'all at the senior center. He gonna go get them greens.
I'm going to get them greens.
Gonna see y'all at the senior center. And y'all have a good week. We'll see you right here next Thursday at 4:30 on Keeping It 100 with CMPRadio.net.
And so I think it's important that you understand the clinical trial process. I'm not saying that the pill is bad. I just want you to think about how to make health decisions for yourself. You want to be especially vigilant, especially staying on top of it. Once I got the information I needed, I started to move in that direction about how to make health decisions for yourself.
In your mind, what would you say to brothers that's not vaccinated or just people in general?
I'm glad to hear you are protected, and thanks for being so honest here on